Wonders Medicine Week. Welcome to the Medical Wonders Medicine Week of 2022 from August 22nd to August 27th. So a reminder is that you need to attend 2 or more calls. Your instructions are given for the whole week and you each get 2 hours per call that you join. We will also be marking down your attendance and recording the meetings. So in order to make sure that you've done your attendance for the meeting, you will be given a homework assignment that is just a 5 to 6 sentence paragraph of what the calls are about. You should have already been invited to the Google Classroom. After you submit your assignment, please put your full name on the paragraph. With that, you'll be able to receive a certificate. So this is how you can list it on your college resume or other common applications. You can learn about the different career paths, professions, college plans, and other pre-medical programs. You can get advice from medical professionals. And if you attend every single call, you will get around 8 to 10 hours worth of shadowing experience. So now let's go over what is Medical Wonders. Medical Wonders is a student-led organization that aims to educate and advise students on medical procedures, careers, discoveries, and devices. We are comprised of several executive teams, including researchers, editors, shadowing, communicators, and graphic designers. We have over 200 members, and we also operate a tutoring program comprised of 50 tutors. We have had many events hosted, which entail 300 people involved, and have also corresponded with other nonprofits for partnerships. Now, let's go over what Medicine Week is. So every day this week, we will have a medical professional student come on to us with Zoom for an hour, give a presentation, go over their career, and lastly, we will end with a question and answering session. In order to check out our full panel board, please go on our Instagram for the full descriptions on each doctor or student. This is our Instagram handle below. This is our YouTube channel, where you'll be able to find the recordings of all of these shadowing sessions. And lastly, you will also be able, again, to give any questions and have the host give any answers that they have. If you want any more updates, please do follow us on Instagram and TikTok so that you can be knowledgeable about this Medicine Week and also garner any future opportunities that we have to offer. Thank you. If you have any questions, please drop in the chat, ask the host, or you can find us at Medical Wonders or Medical Wonders Gmail, our TikTok and YouTube. Now I think without further ado, if we don't have any questions, we can have Ashley begin her presentation. Welcome, Ashley.
Thank you. Hi, everybody. My name is Ashley Flachner. Let me just share my slides. Okay. So today I'll be talking about my path to dental school and just a little bit about me. So I'll be starting at UCLA School of Dentistry in just a couple weeks, and I'm in the class of 2026 and DDS candidate. So a little bit about me. I'm from Rancho Palos Verdes, California, which is a small coastal town in LA. I just graduated from UCSD this past June with a BS in neurobiology and a minor in dance. Like I said, I'll be starting at UCLA, pursuing dentistry, starting in a couple weeks, so I'm excited. Some of my hobbies include yoga, dance. I just started to learn how to crochet. I love volunteering inside and outside of the healthcare profession. I love the outdoors and I love trying new foods. And a fun fact is that I was the student keynote speaker for my college this past June at my graduation. So in this presentation, I kind of broke down my path to dentistry in 4 different parts. So the first part is why dentistry. So for me, I've explored several other options and I landed at this career of dentistry, and my answer will keep me grounded to this career. I'll go into a little bit more detail about why I chose dentistry in a little bit. But for those who might not know exactly what they want to do and maybe have never even thought about dentistry as an option, take a close look about why I chose dentistry, and maybe those reasons will also resonate with you as well. I will also be talking about my volunteering. I'm a super passionate person about volunteering. I think it's so important if you have the resources to give back to your community, whether that's a community that you belong to or one that you're passionate about and maybe does not have the resources that you have. It doesn't necessarily have to be in healthcare. It can be, if you're religious, you can volunteer with your church, you can volunteer at a homeless shelter, anything like that. It's just, in my opinion, I think it's important to give back and find the community that you're really passionate about serving. My third point is that I'll just be talking briefly about the classes and the dental admissions test, which is pretty much the dental version of the MCAT. So it's a standardized test that I will be talking about in a little bit more detail. It doesn't have physics, unlike the MCAT. So if that appeals to you, maybe dentistry is your route. And I'll also be talking about my application once I've taken all my classes and everything. That's kind of the hard part, and just filling out the application, making your personal statement as strong as possible, and also beyond, such as choosing the schools and how I ultimately chose UCLA. So let's start with why dentistry. So for me, I know most people think the dentist is someone who's scary and no one really ever wants to go to the dentist, but for me, these 4 or 5 aspects are really what drew me to dentistry. And if you're considering dentistry, you might have totally other reasons to join, and that's totally fine. I'm just sharing my path, and maybe these also resonate with you as well. So as a neurobiology major, I'm very passionate about science, especially a woman in STEM is wasn't always the case for many years. So it's a relatively new idea that women can pursue these amazing degrees. So I would love to continue learning about science and using my science degree and my interest in science in my career for the rest of my life. I also knew I wanted to be something in healthcare, whether that was a physician or a dentist or anything, a nurse or anything like that. I knew I wanted to be in healthcare, but I didn't know exactly the lifestyle and the choice that I wanted to pursue. So I knew those were a criteria. I've been dancing for most of my life, so I just decided to pursue a minor in dance and pursue one of my passions while I was at UCSD. So through my minor in dance, I've been able to have and broaden my artistic eye. So for me, this is kind of a stretch of an analogy, but I think this is kind of relates to it a little bit. So I've been choreographing dances for most of my life. So, and especially as a dance minor. So when you're choreographing a dance, you have a dancer, a group of dancers on stage, and there's lighting and costumes, and you have to see how the audience would pursue or perceive the dancers, whether they're facing forward or facing to the left or to the right, or maybe if they're in the back, they don't have to look as grand as the people who are front and center. So for me, that's kind of similar to dentistry. You have a full set of teeth, whether that's you're doing a filling or a crown or any type of restoration. And if they're in the front, you want to match the color perfectly. You want to have them as white as possible. But if they're all the way in the back, maybe you don't have to match the color. Maybe it doesn't have to look as aesthetic. So connecting my dance artistic aesthetic side to my science dental side, that was something that I knew I wanted to work in healthcare, but I knew I had this artistic side. So dentistry was one of the few healthcare professions that I knew I could tie in art as well. The next topic is that I'm able to empower others. So I'll be talking about this a little bit more, but I had the opportunity to volunteer as a chairside assistant and an x-ray technician in San Diego to serve those who are homeless or experiencing homelessness or do not have insurance. And obviously they would come in with pain and have some things they would like fix with their mouth, but ultimately our main goal was to empower them to take control of their oral health. Some of these people have never been to the dentist ever, 50 years even. And just to teach them how to brush their teeth or floss their teeth and give them an opportunity to take control of something that we might just take for granted. Oh, we just brush our teeth every day, and we have our electric toothbrush and our water flosser and all these things that we might just take for granted, but some people don't even have a toothbrush. So even just giving someone the ability and the tools to better their oral health, and possibly maybe now they can feel more confident in their smile to go find a significant other, or interview for that job that maybe they felt not as confident or low self-esteem because maybe they had no teeth at all. So giving this ability to allow people to go out and pursue the life that we all deserve, but with the confidence, was something that was really important to me. When you're meeting anyone and they smile, you are definitely going to notice their teeth. So it's just one of the first things that you always notice. And if you have a good smile and you feel good about yourself, you'll feel more confident to pursue the things that you want to do. So I also really like to work with my hands. Like I mentioned, I just learned how to crochet, and I'm making a blanket with like granny squares and stuff. So this is like an example. So anything that you do with your hands in dentistry that's like not dental related is like really going to help you in dentistry. So that's crochet, or I also play the ukulele. Whether you play an instrument or play the piano or anything like that, it'll really help you in this field, especially if you are really passionate about it. So I knew that I really wanted to work with my hands. Obviously, I could be like a welder or anything. There's so many jobs that have working with your hands, but I knew this is one of the criteria that I have. Through tooth waxing courses, you take a bar of soap and you carve it to make it look like a set of teeth. Just many things that I did in my pre-dental career that with my hands really showed me that, okay, I actually have the manual dexterity to actually pursue this career. Because it would have been kind of sad if maybe if I had like really shaky hands or something. So I knew that was something that I wanted to do in my career, because you really do create things in dentistry, whether that's teeth or in dental school, you take wax and you will wax up teeth. And I've taken a course on that too. And it's just really interesting to have combining the art and aesthetics with working with your hands to create something that is ultimately in someone's mouth, which I just think is really interesting. And then also lifestyle. I didn't necessarily like put this in my application stuff all the time, but when you're choosing a career, like many of you who are either high school students or college students who might not know exactly the field you want to get into, it is a career, and you are a human with a life and hobbies and friends and family. So you want to make sure your career will allow you to still maintain all those relationships and all those fun things you like to do. So I know for me, dentistry, both my parents are dentists, and I've had many people in my family who are also dentists. So I've seen the lifestyle that they have is very 9 to 5. They have the ability to come home, cook dinner for their family, spend time with their friends. There aren't many emergency cases. So for me, I definitely want to have a family, and I don't necessarily want to be on call all the time. So that was something that was important to me. If you're someone who would love to be on call and constantly working, there are specialties, maybe like oral surgery, that have more emergency cases, but dentistry is a very, it's definitely not relaxed. That's not the right word, but it is very structured in terms of you go to work and then you come home and there isn't, your patients might call you, oh, I'm in pain. Okay, then here, let me prescribe you some medicine, but it isn't like, oh, let me rush to the office. It is very much, it can wait for tomorrow, unless it's an emergency, of course. But most emergencies can be remedied with some medicine or antibiotics, or just some advice if you have patients who after a procedure might feel pain. So these 5 things, mainly just 4, but lifestyle is also important to me, are what drew me to dentistry. And I hope maybe if you're on the artsy side, but also love science like me, maybe this might be a career for you. Or if you love volunteering or working with your hands, any type of combination of these topics might maybe pique your interest in this field. So my second topic is volunteering, and it's not just the dental stuff. And if you're, I'm sure a lot of you are on the pre-med track. So of course you probably do shadowing at some physician's office or something. I actually was pre-med to start out with. I used to shadow an ophthalmologist, like an eye surgeon. I'm sure you know what that is, but just if you are passionate about volunteering, it doesn't have to be in the healthcare field that you're trying to pursue. And at least for the dental application, I'm sure it's similar for the medical school application. It is really interesting to see other, like the applicants do something different. I'm sure all of you are probably shadowing some type of physician or doctor, or going to and going to put that on your application, that's amazing. That's a great exposure. But if you are passionate about volunteering, maybe consider also doing something that is also more fun, or just something different that might make you stand out just a little bit more on the application. So I chose to show my volunteering with photos. I think it's interesting. It might make me, you can kind of get a glimpse into my life. So starting in the top left photo, I'm the second from the right. And this was most of my volunteering during my undergrad experience at UCSD. So I had the opportunity to, like I mentioned, be a chairside assistant and x-ray technician for the UCSD free dental clinics. And this was just such an amazing opportunity. We're the only undergrad school who has this opportunity. But if you come from any school and you come down to San Diego, you can still be a part of it. You don't only have to be at UCSD. And we had the opportunity to serve those who are experiencing homelessness, those who do not have insurance, those who don't speak English. I'm fluent in Spanish, so I was very valuable, I guess is the word, in the clinic. Many people come from Latin America, mainly Mexico, but also Guatemala, El Salvador, who come to America and might not have the resources to pay for health and dental insurance. Even some jobs that you get here, you might get health insurance, but you might not get dental insurance. Some companies deem it as purely cosmetic, which should not be the case, but that is the case in some places. So we are so happy to serve those communities who might not have the resources. There are people who are veterans who were at war serving our country and come back and lost their job, lost their family, don't have much money, can't find a job. A lot of people who are recovering from drug and alcohol abuse, so they're in rehab. We had a clinic called Veterans Village, which only sees veterans, and they give them food and housing and health and dental care. And me, along with some of my friends up there in that photo, we're the dental assistants, and we have volunteer dentists come and provide the actual dental work. But we're there holding the suction, the air water syringe, just like when you go to the dentist, you have someone there who has like the suction in your mouth and stuff like that. We passed the instruments. We learned a ton about dental anatomy and about all the procedures. This photo was taken in our Lemon Grove clinic, and Lemon Grove is the lowest income city in all of San Diego County. And this clinic was attached to the Lemon Grove Middle School. So it's very convenient for the kids after school, and their families can bring them to the dentist. We also see the parents as well. And we saw mainly kids in this clinic. So it's very nice. It's not like, oh, I have to take a bus and go to the dentist, it's so far away. It's literally attached to the school. So we do free dental health screening. Everything is free if you don't have insurance or you're experiencing homelessness. So that was such an amazing opportunity that I'm so glad I had. In the bottom left picture, through the Pre-Dental Society and the clinics, I became a dental health ambassador. So here in this photo, you can see me teaching Boy Scouts, maybe around like 7 years old, about dental health, how to properly brush your teeth and what causes cavities. And I was teaching them these things, and they had to go around to each little table just to get their dental merit badge. So so much fun to do these outreach events. There was like mommy and me classes where the dental health ambassadors would go and teach the moms the importance of bringing your baby and to the dentist, but also when you're pregnant, to also go to the dentist as well. But of course, let them know so you don't get the radiation from the x-rays and everything like that. But just teaching the younger generation about the importance of oral health instruction, starting young, was really important. In the middle top photo, I had the opportunity to shadow and assist an endodontist, which is a dental specialist who focuses on root canals, which has really piqued my interest in that field as well. And at any dental school, you'll graduate as a general dentist, but if you pursue or you have interest in pursuing a specialty, whether that's orthodontics if you have braces, that's the person you went to. If you're a child, you go to a pedodontist. Those are all specialties. So I got to shadow an endodontist. So here you can see me using one of the hand pieces to drill into a plastic block that has a little like nerve cut out. So I had the opportunity to use the exact hand pieces that the endodontist would use to actually file and do a root canal in this plastic block, which is supposed to mimic a tooth. But obviously he's not going to let me do it on a real person because why would he let me do that? But it was an amazing opportunity. I actually met this dentist in the clinic, in the free clinics, and he offered me a chance to shadow him and see his private practice. So different than a free clinic versus private practice. You can see even just from the back, the big computer and the marble counters and the luxury that a private practice would have. So I encourage you all, whether you're on the pre-med track or you just don't necessarily know, to experience both, whether that's a free clinic or some publicly funded place, but also visit private practice, whether that's just a local physician that you know, or your parents or your family. The patients you get are completely different. The way they react are completely different. This office was in a more luxurious area, so the patients might be a little more pressuring, and I'm like, why aren't you doing this? But everyone in the clinics who don't have like enough money to pay for insurance, they're so grateful for everything you do for them. And I'm sure that you also get that in private practice, but just seeing the different types of patients and different types of offices and the things you would do in these offices, I think was something that really made me stand out on my application, is being exposed to all these different types of communities. So the bottom photo and the right photo are things that I did that were non-dental related. So in high school and a little bit of college, I was a dance teacher and choreographer for young adults with intellectual disabilities, such as, but not limited to, autism and Down syndrome and cerebral palsy. So I got to perform with them in front of crowds of hundreds of people. And you could just see how happy they are dancing with me. And it's just really important. This is one of the communities that I gained a lot of respect and passion for serving. We can just go to summer camp or go to dance class. We can sign up for whatever we want. But these people who have autism or Down syndrome, that you have to try to find a community or a class that caters to them. Like many companies won't even, like many dental offices won't even see someone if it just says Down syndrome on the chart. It's a big liability. But I know I would like to be someone who's properly trained in seeing this community. So not just dentally or like seeing them in the dental office, but giving them the opportunity to go to dance class and perform and learn choreography. We focus mainly on tap dancing. So I love tap dancing, and being able to choreograph and perform with them on stage. You can see they're on stage. It was just such an amazing experience. And I did that for all of high school and several years into college. So by the time I applied to my dental school, I already had about 7 years of experience with leadership and everything. So it's such an amazing thing to do just for a while. And that's one of my also pieces of advice. My other pieces of advice is to, of course, try all options, but once you find something you're passionate about, try to put a good amount of time into it. I've realized that on your application, if you have 50 things that you tried for 30 minutes, it's impressive that you had time to try all these things. But if you just tried one thing for a year, it'll mean more, and you'll have more stories to tell the admissions committee if that's what you're applying to. And then on the right, I was a camp counselor for 6-year-olds with autism and Down syndrome. And this is one of my favorite campers. We were like the red group, as you can see. And it's just so amazing to have all the activities catered to them. They had the ability to ride bikes, but they were like with 4 wheels, so those can't possibly fall off. And they had just like water balloon fights and all these things, but all catered to them and their needs and everything like that. So it was such an amazing experience too. This was a paid opportunity, a job, but I didn't even know that at the beginning, but it was just such an amazing opportunity to work with this community. Yeah, so that's my volunteering. I thought it was fun to share it with photos. So now I'll talk a little bit about the classes that I took and the dental admissions test. I don't want to go into too much detail, just if you know you're not on the dental track, or maybe you aren't even in college yet, you haven't even registered for these classes, but just kind of keep them in mind just in case. I was a neurobiology major, so a lot of these courses overlapped with what I needed to take for dental school. But with that, I took chemistry, general chemistry, and so, okay. In the field of chemistry, there's general chemistry and organic chemistry. For me, I was on the quarter system, so I took 3 quarters of each, and then a quarter of general chemistry lab and a quarter of organic chemistry lab. And then I also took the same with physics and biology. As a biology major, I took upwards of 12, 15 classes of biology, lower division, upper division, with lab, of course. So these chemistry, physics, and biology are just the standard things that almost all dental schools require. If you're a biology major or biochemistry or bioengineering, you most likely already fulfill these with your major, but you can pursue any major and be accepted into dental school as long as you just meet the requirements. So if you're a different major, it might be harder to fit those requirements and these like STEM dental school requirements, but it's definitely doable. And if you're a different major besides biology, let's say you're psychology or even history or something that's totally outside of the STEM field, it makes you, it's like a topic of conversation. So most people who apply are biology or some version of that or chemistry, but don't be defeated if you're not. Like, it's definitely doable and it will make you stand out more. And some of the schools also require English, psychology, calculus, or a second language, or art class, or something like that. But the majority of them, these are the core: chemistry, physics, and biology. Yeah. So for the dental admissions test, like I mentioned, it's pretty much the standardized test like the MCAT that you probably heard of for medical school. And I am not too familiar with the MCAT, but I know the DAT does not have physics, but the MCAT does. And I am not a huge fan of physics, so that was good to hear. But as you can see on the right, this is my test score, just as a sample, not for any type of comparison or anything, but just if you take the test, this is what you get. It has all the categories on it and everything like that. So I took mine during COVID, which sounds bad, but it was actually great because it was like the first summer of COVID and no one was doing anything anyway. So I would spend the whole summer studying, but I'll get to that schedule part in a second. But the sections, if you're a biology or chemistry or STEM major, you probably already learned a lot of these. So there's biology, general chemistry, organic chemistry, reading comprehension. I'm sure you had a lot of practice with that, whether even if you're in high school taking the SAT, it's much the same. You just read and you answer some questions about it. And quantitative reasoning, which is just math, which is a fancy word for math, a little bit more difficult. They have some more logic-based things, but there's still algebra, things like that you have to solve for X and those type things. But the only thing you probably haven't seen is called perceptual abilities. So perceptual ability is kind of a set of 6 different types of puzzles that you kind of have to use. It takes a ton of practice, and it was not my best section, as you can see, but you kind of have to learn how to use shadows and context clues to kind of see what's behind something without actually seeing it, which is really important for indirect vision in dentistry. You can't always see every side of the tooth. You can't take the teeth out of the mouth and turn it around. So you kind of have to use like mirrors and things to use context clues when doing dentistry. So this is kind of preparing you for that. It'll give you like 3, this is like one of the examples was like cube counting. So it'll give you like a huge structure made of cubes and you can't see all the sides. You can just see there's one tall tower and you don't know how many cubes are under, but you know the scale of the cube. So you kind of have to guess and figure out how many cubes are under, and it'll tell you like how many like cubes there are, like how many cubes are like painted, which means like how many cubes have like 4 faces exposed. It's like, that probably doesn't make much sense, but if you pursue the dental admissions test, you will be very well versed in all these things. That's probably just something that the only thing you probably haven't seen if you're like a STEM major and you're already in college. But my recommendation is if you do not want to take a gap year and you already know you want to do dentistry, take this test this is what I did. So this is my recommendation. The summer between your sophomore and junior year, or second and third year of college. So by the time the next June rolls around, which would be your end of your junior year, you can apply and find out that December. And then by the following June, when you graduate, if you pursue a 4-year degree, then you can just start in September, which is what I'm doing. But if you do want to take a gap year, you can take it whenever you want, obviously. But if you only want to take 1 gap year, you would take it after your junior year. If you want to take 2 gap years, you would take it after you graduate. But that's just my recommendation. That's just what I did. But you can follow any schedule you would like, or talk to other pre-dental students as well. So as far as the numbers go, they range from 1 to 30. Anything above a 25, you're already in the 99th percentile. It's extremely hard to get anything in any section over 25. As you can see, my total average was only 21. But the academic average, or the total average for the whole nation, is 19. So anything above 20 or 21 is usually pretty competitive. And I know like UCLA, like where I'm going, is a huge name school, but as you can see, I did like I'm just like a little bit above average. It was nothing phenomenal on this test, but everything is weighted very holistically. So maybe the admissions committee was really fascinated by my volunteering, or I did have a high GPA. So everything balances out. So if this test doesn't go as planned necessarily, there's no need to worry that much. Like you can take it again, but the more you study, like the more you'll forget what you learned at the beginning. The same goes, I assume, for the MCAT and stuff like that. So I wouldn't worry too much about that, but obviously try your best. So I use Dat Bootcamp, which was this software. I'm sure they also have them for the MCATs and stuff too. It's just a more new, updated than just like Princeton Review, or like one of those old or studying companies, testing companies. So it has everything from every subject. You can go in knowing nothing. If you're not a STEM person, you can know nothing about biology, nothing about photosynthesis or whatever, and they'll teach you everything. They have lecture videos. The tutors and the teachers are extremely interesting, and sometimes they're funny, and they also have student tutors you can ask anytime. Oh, I don't really understand this, can you explain it? And they'll draw you diagrams and cater to you, which is very what I needed. I didn't just want, okay, here's all the information, take it in at your own time. We're not helping. So they're very, very helpful. All the subjects, tons and tons of practice tests, and it was actually harder than the real thing. So if you go with this Dat Bootcamp and you're interested, just know that it's harder than the real thing, which is better. So if you do a certain score on this Dat Bootcamp, you're probably going to do better on the real thing. So that was helpful. And in terms of time management, like I mentioned, I did it during the summer, which was an 8-week schedule, which they gave me on Dat Bootcamp. I followed it to a T, exactly what they said. Just like, okay, I'm waking up at 8 a.m. and I'm going to do this practice test for biology and read this chapter of chemistry, and doing like you do almost every section a day. And I spent about a total of 600 hours studying for this, but I just wanted to get it right the first time. I really didn't want to have to retake it during the school year or anything. So they give you a schedule, which is really amazing. But of course, I took every Sunday off just because I wanted to spend time with my family, my friends, and all that stuff. If you have a significant other, let them know beforehand that you're not going to be as available to do like fun date ideas and stuff, but also make sure you spend time with them as well. So just give everyone a heads up that you might be kind of MIA at your desk for like ever, but once that's done, then you'll be free to just work on your classes and your application, and you don't have to worry about it anymore. Yeah, so my last section is my application and beyond. So just kind of tips on the dental school application and how I chose UCLA, or how any student would pick a school, like what factors are important into that. So this is just the final push of we already taken your classes, you may be already taking your DAT already. And so what I did, the first part is just putting in all your information, your personal information, but also you have to put in every single class, the grade you got, including your APs if you're in high school, if you took any in high school. Some dental schools won't take APs, so just make sure you check in with the school if that's something you're interested in. But for me, APs weren't that great for me in high school, so they didn't really count anyways. But the ones that did count, I'm fluent in Spanish, so I did really well in Spanish AP in high school, so I didn't have to take it in college. So it helps a little bit in terms of getting your units up. And at least at the UC system, your enrollment time for getting into classes was based on the number of units you had. So if you're in high school and you don't necessarily know if you want to take AP or not, obviously if you have like lots of sports and other things, you don't have time, of course, like balance everything. But if you do have time, I recommend taking them. They do usually transfer over, and you'll get more units just to start out when some people don't have any. So you might have a better enrollment time and just kind of get some classes out of the way if you have a very rigorous schedule, like if you're a biology major or double major or anything like that. So for letters of recommendation, I had 2 professors, so one organic chemistry professor and one biochemistry. I met them online during COVID on Zoom University, so we love that. I never actually got to meet them in real life, but they'll still write you a really good letter of rec. I just recommend you go to like office hours and stuff, but now stuff is in person for now. So I recommend you getting a good connection with your professors, even if you're just in your freshman year of college. Like you might have them again for something else, or it's just always a good idea to befriend your professor. Like, why not? So, and then I also got a letter of recommendation from a dentist who I worked with a lot in the dental clinics, like what I was referring to, and also the volunteer coordinator for that when I was a dance teacher for the young adults with intellectual disabilities. I knew her for 7 years, so I didn't really get to see it, but I'm sure it was a strong letter of rec. And for the personal statement, I'm not sure if they require this for medical school too, but they probably have something similar. But at least for dental school, it's pretty much answering that why dentistry question. So the question I was referring to before, of what made me passionate about dentistry. So I can't just say I'm passionate because of the art and aesthetics and the healthcare, like what I was talking about. I had to give examples of what I've done. So like that whole example with the dance choreography is similar to dentistry, and the lighting and the rotation and the aspects and all that stuff. So you kind of have to connect what you do as your extracurriculars to why you want to do dentistry, or empowering others. And those examples that I gave about people come in, maybe haven't been to the dentist in years, but having the ability to empower them to take control of their oral health, and seeing their gratitude and appreciation. That's what really pushes me toward this career. So just showing what I've done, in a way, kind of showing off what you've done, but in a humble way that relates to dentistry. And don't be afraid to show off a little bit. This is your time. You've done so much in terms of classes, extracurriculars, even just attending these webinars and being part of like Medical Wonders. It's such an amazing organization. So even just doing something online like this is going to help you shine, and mention it in your personal statement. And, oh, I did this and I went to these webinars and I heard from these professionals and everything. Everyone's showing off. So don't be, of course, be humble about it, but share as much as you can. You took time to do them, so might as well tell people about it. So for me, choosing schools, I'm from LA, like I mentioned, so I wanted to stay in California, just to be close with my family. My boyfriend goes to school in San Diego, and he's going to move up to LA soon. So I just wanted to be close to everyone who I love. It's an enormous change to go to grad school, whether that's even just going 5 minutes from your house. It doesn't matter where it is. It's a huge transition. And for me, I wasn't ready to just go somewhere else. And so I wanted to stay in California. So that location was a big thing for me, but access to specialties, whether that would be, I know I was leaning towards possibly specializing. So UCLA had all of the specialties. So I have as many options as I can. Ability to get scholarships or financial aid. I was awarded the Dean's Scholarship for the first year. So just knowing if schools give out scholarships or financial aid was something that was important to me and my family. The class size. So UCLA only has a class size of 88, but my dad's from New York, so he went to NYU to pursue dentistry, and the class size there is over 300. So if you're someone who likes big class sizes, then maybe UCLA might not be the best option for you. But I came from a huge school, UCSD, so I wanted to go somewhere that was smaller and I could actually know all my classmates. So that's what's important for me. And that kind of goes into my decision of why I choose UCLA. But in terms of interviews, I applied to 6 schools, all the 6 schools in California. I interviewed at 4 of them, and I was accepted into those 4 as well. So, so take the interviews very seriously, of course, but they're actually very relaxed. So I know, at least for dental school, I know it's really stressful. You're like talking with the dean sometimes or something like that, but it's a way for you to show your personality, whether like you've already shown you're an amazing student and you've done all these volunteering, but they really do want to see and choose someone with some personality as well. Even just if you're like, I'm a shy, introverted person naturally, but I like public speaking like this. So whenever I'm talking with other people, people can see my personality. But even if you're don't like public speaking or anything, talking about your hobbies or things that are unrelated to medicine or dentistry or whatever you're going to do just shows a little bit more about yourself. So that is what I also liked about the interviews, and they were fun. But most of them were online, just because it was during COVID, but hopefully for you all, it would be in person. So these are just my little pieces of advice that I have not like throughout my path of going to dental school. These are the 3 things that helped me the most, besides obviously doing well in school and studying, but I don't really consider that advice. That's like something that you should probably do anyways. But so explore all options. I know a lot of you who are watching this are high school or college students, and it's totally fine if you don't know what you want to do. Like, I know there's probably people around you who are like, oh, I know exactly what I want to do. Like, that's great for them. And that goes with the 3rd piece of advice about your own path. I'll get to that in a second. College is a great time to explore like all the fields, whether that's inside and outside of healthcare. So I know like during this medicine week, you'll hear from other professionals who are in healthcare, and of course, Medical Wonders is a healthcare organization. But if you are maybe not certain about healthcare, explore other things. I know I used to want to be like an interior designer or a marine biologist. And if money wasn't an issue or a factor, maybe I would be pursuing that as well. But just choose something that's also not just about the money, but about your passion. So whether that is helping those with intellectual disabilities like me, or maybe you are passionate about going on mission trips if you're someone who's more religious, just pursue something that you're passionate about. It doesn't have to be healthcare. Like, explore all the options that you can. My second piece of advice is to get involved as soon as possible. I joined my pre-dental society almost the first second that I was on campus, after I realized that maybe medicine and med school wasn't necessarily the field that I wanted to go with. But depending, whatever you want to choose, there's going to be a club. There's going to be someone who wants to do it. And if not, you can start your own club, which I know you've probably heard already, but there's probably other people like you as well. So find mentors. My mentors have been so helpful. I've had people who I mentor as well and give them the type of advice that I'm giving you all today. Volunteer, enjoy your hobbies. College is rough, like wherever you go, of course, but just make sure you maintain like who you are. Like, don't change who you are for other people. If you do something that you think is quirky, like making a crochet blanket in the middle of the summer, like me, like that's totally fine. Like, enjoy what you do and don't be like someone else who you're not. And it's also never too late if you're like a 4th year or 5th year, or however long it's taken for college. Like, you can start pursuing the path to dentistry or med school or whatever you want. But also on the flip side, it's never too early to start. Whether you're in high school and you know you want to pursue dentistry or a certain career, get started with it. Like, you'll be so ahead if you start early, but also it's never too late to start. And my last piece of advice is to just be like on your own path. So something that has been really difficult for me is comparison. So I have always been comparing myself to other people. Oh, they did better on this test. Like, maybe I shouldn't be on this path anymore. Or social media is very controversial in my opinion. I think it's a great way to pass time, TikTok and all this stuff, but it really can affect your mental health. And I have been through that as well. So just make sure you're on, that you're on your own path. Just focus on yourself. You'll see other people doing things or get FOMO or whatever. But in terms of academics, like, you're on your own path. If you fail a test, that's like, I failed a test in college, like many, like not many, but multiple. And now I'm going to UCLA, which has been my dream. So just know that you're on your own path and you don't have to compare yourself to other people, especially on social media. So yeah, that's my presentation. Thank you. If you have Instagram, feel free to follow me on Instagram. or email me at aflachner2026@ucla.edu. I will answer any questions. I am on Instagram. You can DM me any questions you have. And thank you so much for listening.
For giving a wonderful presentation. If anyone has any questions now, please do respond in the chat or discuss directly. So just out of curiosity, when did you graduate high school and what types of activities did you do in high school?
Yeah, so I graduated high school. Oh god, it's a long time ago. 2018, I guess. And so I went to Palos Verdes High School. In high school, I was part of a lot of like the National Honor Society and Spanish Honor Society, all those honor societies, academic things. But the main like volunteering that I did was like the one that I mentioned. It's called Ready, Willing, and Able, which is pretty much where I was a dance choreographer and lead mentor and all these things for the young adults with Down syndrome and autism, which really allowed me to gain a perspective into this community that maybe you would have never known about, or maybe I would have never known about. I know the people who have intellectual disabilities, they like weren't in my classes, they go to different classes, they might have even been to a whole different school than what you're used to or the one that you go to. So just having the ability to open your eyes to a new community was something that was like really important to me. And it was, so I did that for most of my time. I was on the dance team as well. Yeah, that was like my main source of extracurriculars. I was a camp counselor for a couple of years for young adult, or actually there's children with autism and Down syndrome too, like I mentioned in my presentation. So I was also a student tutor with my grades and stuff. I was like a very good student in high school. So I wanted to inspire the other kids in my school and also like middle school as well, to really put like a big emphasis on education. And I would help and go to those people's houses and tutor them. So yeah, those were my extracurriculars that I was doing. I know there are some questions in the chat. Sophia, can I just answer them, or would you like me?
Yeah, you can definitely answer them. So,
Okay.
So Elisa asked, how do people with a non-science background enter STEM field?
Yeah, okay. So I'll answer this question. So I'm a STEM person, so I don't know exactly, but I've had many friends who are like political science or education, or who are non-STEM, which is totally fine. There are so many clubs and organizations, including this like Medical Wonders, something that was like this, that whether it's on Instagram or if it's a real club at your college, there are career fairs and club fairs all the time. At least at UCSD there were. I'm sure they have it at many other colleges as well. So even just going up to their booth and asking, oh, what kind of things do you do? Like maybe they do some type of, they offer hours like this, or you have the ability to shadow a doctor, or anything that you're interested in, or anything in STEM. It could be research as well. It doesn't have to be healthcare. So my advice would just be to look around at clubs, and there are many STEM clubs, and it doesn't matter what major you are, what year you are, what you want to do as a career. It's totally, most of them are all very accepting of many types of people. So I would just either make friends who are in STEM who can like get you into that organization, or just take it upon yourself to find those organizations.
So we have another question in the chat from Reedy. So Reedy asked, what do you think made your application strong, and how can we get started with volunteering?
Yeah, so for me, I think my application that made it strong was actually things that were non-dental related. So everyone who's applying to dental school or whatever field you want to do, they've all, or a lot of them have done shadowing. They've all done pretty well on the DAT. They've all gotten pretty good grades. So you're all kind of in the same boat there. So pick something that might make you stand out. So my volunteering that was non-dental related with the community that most people don't even really notice in the world or might view as inferior, which is definitely not true. The people with intellectual disabilities are some of the most honest and true and fun people I've ever met in my whole life. So I would recommend even just volunteering. Honestly, that's just my answer. Just, I love volunteering so much, but especially if it's something that makes you unique, or shadow someone who maybe not many people shadow. So I think making your application strong can be achieved by just putting yourself out there and doing something out of the norm. So whether that's a medical school or dental school, everyone's doing a similar thing academically. So even if you like pursue a sport, it doesn't even have to be volunteering, a sport or a hobby or something that is a topic of conversation. But once you get to the interview, they're not going to ask you, okay, tell me how you did on this organic chemistry class. Like, they already know. So it's very personality based. When you get to the interview, they want to know about you. They don't want to know, like, you're an amazing student, and you applied and you're here to the interview stage, but something that'll make you stand out is my answer. Yeah.
So we have our last questions from Fatima. Fatima asks, are there any techniques that you think added to the strength of your application? And Fatima is from Canada, so her university system is different, but she's asking just about, the techniques and the ways you filled out your application.
Yeah, so like you said, I'm not exactly sure how the Canadian application works, but at least for the one in the US, just when you fill it out, fill it out as if you have no idea what you did. Like, you're kind of explaining it to someone else. So if you did this webinar, for example, you wouldn't just be like, oh yeah, I talked to Ashley. They don't know who Ashley is. They don't you really want to be very explicit and specific about what you're putting, and put as much information as possible. So if you shadow a doctor, put like, I shadowed this specialty or whatever, let's just say like ophthalmology for 2 hours every week with, this is the name of the doctor, here's their reference, if you got a letter of rec or something like that. But just be as specific as possible and as many things as you learned. I think that was one thing that might have set me apart, is that in my experiences, I didn't just say I did this. I said I did this and this is what I learned from it. Whether that was I learned how this type of community is like valued or maybe not valued in society, or like working with veterans, just having the ability to know, like, we can't bring up certain topics. So I've had the ability to talk with different types of people who you might not talk to on a daily basis, just kind of showing what you learned, not just that you did all these things. And the same thing goes with the personal statement. What I was mentioning, if you just say you did all these things, you already put them probably in your application, and it's really fine to repeat it, but they want to know like why you did these things and what you got out of it, not just that you did them. So I think the strength of my application just came from actually explaining things and not just assuming, oh, they know what shadowing is, like it's the same for everyone. It's not. Like, if you shadowing versus assisting is totally different. If you do it for 1 hour one time or a whole year, like every day, it's totally different. So just be very specific and show your interest, not just, oh yeah, I did all these things, like whatever. Like, really show your interest, whether that's on your application or in the interviews as well.
Yeah, so thank you for answering all those questions. I think that's all we have for today, and it's right around 3 p.m. Eastern. So I think I'll let Sonia wrap this up, or if she has anything else to add, or if you have anything else to add. And if you have any remaining questions, you can just put them in the chat as well. But thank you everyone for coming. We hope to see you on the remaining days of medicine week, and make sure to go reach out if you have any questions, and make sure to go check out the Medical Wonders Instagram in order to get a bigger and a better glimpse of the other events that we're hosting.
Thank you.
No problem. Thank you, and bye everyone. Everyone have a great day.